illustration I saw in medical school by Thomas Edison. It said, the doctor of the future will give no medicine, but instead will interest his patient in the care of the human frame, in diet, and in the cause and prevention of disease. And one of Thomas's brighter ideas. And when I saw this quote in medical school, I just passed it right on by. I went to the University of Illinois College of Medicine in Chicago, and I was so into becoming a real doctor, and real doctors do real doctor things. They deliver babies, they fix broken arms, they sew up lacerations. That's what real doctors do. And diet was boring stuff. And nutrition, yeah, you send them down to the dietitian, and they figure out a 2,000 calorie diet, and don't bother me. And that's how I practiced medicine for the first 8 or 10 years of my career. Well, I have soon, or late, come to realize how important what we eat really is in the creation and prevention of so many of the diseases that we see today. And I'll tell you how I came to those realizations. Now, the North American diet has changed. This is not going to be a technical lecture, but I did want to show you this one graph because there are some very significant lines here. The two top lines, the lavender line and the yellow line, are the amount of plant-based foods that are consumed in the United States and in Canada as well. And this is back in 1909. You can see we were eating a lot of grain products. We were eating almost 300 pounds of wheat and barley and other grain products, and almost 200 pounds of potatoes a year. Look what happened in the intervening 85 years. Our consumption of wheat and grain products have fallen to half of their 1909 level, and our potato consumption has fallen to half of their 1909 level. Look what happened to the amount of flesh foods that we are eating. The amount of milk we consume has more than doubled. Our beef consumption's gone up by 50%, and our chicken consumption's gone up by 280%. We are eating a tremendous amount of animal flesh, and we have essentially exchanged a plant-based diet for a meat-based diet. And the results have been just disastrous for both our health and the environment. Consider how much animal flesh most North Americans eat. In their lifetime, the average meat-eating American is going to eat 15 cows. Going to eat 24 hogs, eat 12 sheep. She will eat 900 chickens and 1,000 pounds of assorted animals that either swam in the water or flew in the air. That is a tremendous amount of animal flesh to be pouring through the human bloodstream year after year. No wonder we wind up with clogged arteries and high blood pressure and cancers and a lot of other diseases, and I'll show you how those two are related. Let's talk about the health effects of an animal-based diet. Here it is, the great American dietary catastrophe in all its glory. I grew up thinking this is good food. What's for lunch, Mom? Oh, I got something good for you, son, she'd say. And she would give me some food like this. And my mother didn't know, and your mother didn't know. They didn't know that the sausages and the eggs and the ham were just loaded with fat and cholesterol. And this is a coronary artery thrombosis waiting for some place to happen. Now, what is the effect on your body when you eat food like this? Well, the effect was brought out very dramatically to me about 10 years ago. I was on the cardiovascular anesthesia service. That's the service that deals with people's hearts and blood vessels. And like all good anesthesia residents, I was making my rounds one evening to see my patients for next morning's surgery. And the last patient I was seeing, I pulled back the curtain, and there was Mr. Phillips. Nice fella. But he was just huge. He weighed 290 pounds, and he was booked for a 4-vessel coronary artery bypass procedure. He weighed 290 pounds. 290 was also his systolic blood pressure. It was also his cholesterol level. It was also his blood sugar level. I called him Mr. 290. Nice guy, but really clogged up in his arteries. And because it was late at night, it was too late to call the blood drawing technician up to draw his blood test, I drew his preoperative blood work into a glass tube, and I put it out at the nurse's station, and later I came by to pick up the blood tube and take it down to the laboratory, and when I looked at the tube of blood, I couldn't believe my eyes. When you draw blood into a glass tube and let it sit there for an hour, it separates out into two parts, and the red clot settles to the bottom, and the liquid part of the blood, the serum, rises up to the top. Here you see two tubes of blood, and the tube on the left is normal serum, is normal blood. Here you see the dark red clot, and this golden yellow liquid, this is normal serum. This is what your blood is supposed to look like. But I looked at Mr. Phillips' tube, and it was just shocking. The serum floating in his tube was thick and greasy white. It looked like Elmer's glue. It stuck to the sides of the tube when I shook it. I went back into the room. I said, Mr. Phillips, did you eat before you came to the hospital? He said, yes. I said, what did you have? He said, I had a double cheeseburger and a milkshake. And when he said that, I realized what I was looking at was all the fat in the beef burger, and the butter fat, and the cheese, and the butter fat, and the ice cream, and the butter fat, and the milk had oozed out into his blood and turned his blood fatty. It's a well-known clinical phenomenon. It's called lipemia, and it happens every time you eat a fatty meal. You turn your blood fatty, and your blood stays this way for 4 hours until your liver can clear it out of the bloodstream. If you are like most North Americans and eat bacon and eggs for breakfast and a cheeseburger for lunch and fried chicken for dinner and ice cream for dessert, you're keeping your blood fatty all day. The stuff never clears out of the bloodstream. You keep your blood fatty for 40 years, 50 years, 60 years. What do you think is going to happen to the arteries carrying all that fat? I will show you what happens to the arteries carrying all that fat in a few minutes, but it's a disaster. There's a lot of fat in the North American diet, and it's hidden in most foods. You can see the fat around a T-bone steak, but most of the fat is in the muscle of the animal, and it's hidden in the dairy products. And most of the folks who present food to us don't want us to think about the fat, especially the fast food industry. They really don't want you to think about how much fat is in their burgers and hot dogs, except one chain of fast food restaurants in Los Angeles. There is one burger chain that is very forthright about the reality of the fat content of their diet, and they come right out and tell you clearly on their marquee about the product that they're selling. Now, if you stood outside the exit door of this restaurant or McDonald's or any other fast food restaurant where people are shoveling in their cheeseburgers, if you stood at the exit door with a needle and a syringe in your hand and drew blood on the people walking out the exit door, what you would see is most of the blood would be as fatty as Mr. Phillips' blood tube. Now, they're all in there making a blood fatty. Did you ever have a big cheese pizza and a bowl of ice cream afterwards and you feel a little greasy on the inside? It's because you really are. You really go greasy on the inside. Animal fat comes in 3 flavors in the North American diet. It comes in the form of red meat, and the fat is in the meat. It is in the fibers of the animal's muscle, and just trimming off the white fat around the edge of the steak really does not lower the fat and cholesterol content significantly of the meat. So red meat is the number 1 source of fat and cholesterol in the North American diet. The second is the yolk of hen's eggs. The egg of a chicken is meant to hatch baby chicks. And the yolk of the hen's egg is one of the most concentrated gloms of fat and cholesterol on the planet. It is made to power that baby chicken for 21 days with no other energy. And when you run egg yolks through your bloodstream, you turn your blood fatty, just like Mr. Phillips. And the third source of fat in the North American diet comes from that white fluid that comes out of the udder of a cow. Now, cow's milk is a high-fat fluid exquisitely designed for turning a 65-pound calf into a 400-pound cow in a year. That is what cow's milk is for. Now, whole milk has a butterfat content of 3%. That's the cream that rises up to the top. And you drink a 3% solution of butterfat, you're going to turn your blood fatty, as will a 2 and 1% solution of butterfat. But at the dairy, the butterfat is skimmed off, and they concentrate it into huge vats, half the size of this room. And they concentrate the fat to 50, 60, 80, 90% fat. This stuff is so thick you can walk across it. Why do they do that? Well, they do that so you will buy it and eat it. The butterfat is mixed up with air until it hardens into chunks called butter. The butterfat is mixed with sugar and frozen and sold as ice cream. The butterfat is mixed up with cocoa powder and sugar and sold as milk chocolate. The butterfat is mixed up with bacteria and allowed to ferment until it turns into sour cream. A lower fat version is called yogurt. And the butterfat is mixed up with calf's stomach and bacteria and allowed to ferment for about 6 weeks till it hardens into chunks called cheese. These are all forms of butterfat. The folks at the dairy want you to buy the butterfat and eat it. And when you do, you turn your blood fatty. There's absolutely no reason to run butterfat through your bloodstream at any time, and I'm submitting to you that you'll be a lot healthier and happier if you do not. Cow's milk is for baby calves. You have no more need of cow's milk than you need giraffe milk or horse milk or rat milk. Now, back to Mr. Phillips. Nice fella, but I was impressed with all the fat in his bloodstream. We took Mr. Phillips down to the operating room, and I gave him 1,000 micrograms of fentanyl and put him to sleep, and the surgeon opened up his chest and opened up his aorta and opened up his coronary arteries. And what the surgeon started pulling out of Mr. Phillips' arteries were great, long, yellow, greasy, sausage-like formations of fat that looked like this. What you're looking at is a plug of material called atherosclerosis. And this is the plug of fat that built up in a man's arteries. The artery was a tube coming out at you from the screen. The artery wall has been cut away, and you're just looking at the fat that built up. It started around the edge of the blood vessel and started moving in on the blood flow channel as the years went by. And the blood flow channel got smaller and smaller and smaller till only this dark red spot was left for the blood flow to come through. And when a clot formed here, it stopped the blood flow completely through that artery. And because it happened in this man's right coronary artery, it stopped the blood flow to his heart and brought him a ticket to the autopsy table. This is the #1 cause of death of people in North America. Every 30 seconds on this continent, Canada included, somebody grabs their chest and falls over with a heart attack. This is animal fat clogging up the arteries. When you send this material down to the pathologist and you ask him to analyze it, the report always comes back the same: saturated fat and cholesterol. It's animal fat. The pathology report never, ever, ever contains the words remnants of broccoli, rice, and tofu. It's animal fat. The good news is when you stop running animal fat through your bloodstream, this stuff melts away. This stuff will come off the artery walls, and arteries can open up. And Dr. Dean Ornish in California and Dr. John McDougall and a number of other physicians are now routinely reversing atherosclerosis, having people cancel their coronary artery bypass surgery because they've changed their diet and their arteries have opened up. That's the good news. Here is the process happening. Here are 6 arteries coming out at you from the screen. The dark red circle is the artery wall. The pink material is the atherosclerotic material clogging the artery. The white spot is the blood flow channel, which is getting smaller and smaller and smaller. Any organ dependent upon this blood vessel for its blood flow is in trouble. Fortunately, it's a reversible disease. This atherosclerotic material clogs arteries all over the body. It's just a matter of which artery to which organ clogs up first that gives you the symptoms. If the yellow atherosclerotic fat builds up in an artery going up to the brain, you will suffer a stroke. If it clogs an artery going to your kidney, you'll suffer kidney failure or high blood pressure. If the atherosclerotic material accumulates on the walls of large blood vessels like the aorta that takes blood from the heart down to the abdomen and legs, the artery walls become damaged and weaken. They lose their strength. And the high pressure in the blood vessel causes the artery to balloon out, forming an aneurysm, which can then rupture, leading to emergency surgery or death. If the yellow atherosclerotic material clogs up an artery going to a loop of intestine, the general surgeon will open your abdomen and remove that loop of bowel. If the atherosclerotic material clogs up an artery going to a toe or foot, you will watch that toe or foot turn dark and gangrenous, and you'll sign permission forms for amputation. And if the atherosclerotic material clogs an artery going to the heart, you will suffer crushing chest pain when you walk, called angina pectoris. Or if it clogs the blood flow completely and damages the heart muscle, that is a heart attack. People, this is all the same disease. We are talking about animal fat essentially clogging up the arteries throughout the body, and it's the #1 cause of death and disability in North America. And this is essentially a disease of people who eat animals and the products made from animals. You almost never see these diseases in pure vegetarians. And William Costelli, the doctor who runs the Framingham Heart Study, says he has never seen a heart attack in anybody with a cholesterol below 150, and there's good reason for that. Why does this happen? Because all fats are not created equal. There is a fundamental difference between animal fats and plant oils. Animal fats contain cholesterol. No plant food contains cholesterol in any significant amount. It is an animal product. And very importantly, animal fats are highly saturated. They've got lots of hydrogen atoms hanging on them, and that makes animal fats very stiff. In fact, animal fats are solid at body temperature. If you're in a kitchen on a summer day and you've got a piece of T-bone steak on the counter and it's 98.6 degrees out, the same as your body temperature, the fat on that beef steak is solid. It's a nice white chunk sitting there. If you have a bottle of olive oil on the same table at that same temperature, it's liquid at that same body temperature. I don't know about you, but I don't want to eat any fat that is solid at my body temperature because it's going to start clogging up my arteries. And that's the beauty of plant oils. They're liquid at your body temperature. They really don't cling to your arteries. Animal fats contain a substance called arachidonic acid. And arachidonic acid stimulates the creation in the body of a substance called prostaglandin 2. And prostaglandin sets off lots of inflammatory reactions in the body that can irritate the blood vessels, perhaps contributing to atherosclerosis. It may well cause a lot of inflammatory reactions in the joints, the skin, the bronchial